Hi everyone, welcome back to a brand new episode of ET Markets IPO Talk, where we talk about the latest IPOs in town and more. Today we are going to talk about the Yatharth Hospital IPO. This IPO is coming out on July 26th and will close on July 28th. Now, to discuss this, we are joined by the management of the company. We have Mr. Yatharth Tyagi, whole-time director at Yatharth Hospital and Trauma Care Services Limited. Thank you so much for joining us on ET Markets live stream, Mr. Yatharth.
Hello, good afternoon.
So, to start with, the IPO is going to hit the markets on July 26th. Can you briefly tell us about the business?
Right. So, the company was incorporated in 2008 and 2010 is we started our first hospital. Right now, the company operates 4 hospitals. 3 are in Delhi NCR in the cities of Noida, Greater Noida and Noida Extension. And 1 hospital the company recently started, it was an acquisition and it started last year in the Jhansi Orcha territory, that is in Madhya Pradesh. So currently around 405 beds, roughly around 600 doctors, and these are super specialty hospitals where the hospitals are catering to all the specialties like internal medicine, gynae, pediatric, ortho, as well as super specialties like neurosurgery, cardiology, and high-end. Recently we started transplant program like kidney transplant, bone marrow transplant, as well as going forward we have huge plans for oncology. This year the fiscal 23, between 21 to 23, the revenues had a CAGR growth of around 50%. So highest in hospital industry.
So I just want to the next question I want to discuss is about the financial performance. As you were telling us about the financial performance a little bit, can you elaborate a little bit more on that?
Yes, so the fiscal 23, the total top line company did was 520 crores, which was up from 402 crores the year before that, and from 250 crores to a couple of years back. EBITDA has also grown in that line. Roughly, the company is doing roughly around 26% of EBITDA, which is quite high as far as the healthcare industry is concerned. The EBITDA for the fiscal year 23 was around 133 crores, and one of again high profit net margins, where fiscal 23 the company made 66 crores of profit. Ever since the company has incorporated, it has always been EBITDA positive, maintaining margins of above 20% throughout those 8 to 10 years. And even the profitability has always been there, except the year 2019, when 2 of the new hospitals started for the company. But ever since, the company has been very profitable.
All right. So when it comes to future prospects of the company, what are you planning? Are there any expansion plans? What is for the future?
So, the strategy is to grow both organically as well as inorganic. So, 2 of our hospitals which are located in Greater Noida and Noida Extension, these are already among the top 10 largest private hospitals of Delhi NCR in terms of number of beds. So Noida Extension is 8th largest and Greater Noida is 10th largest hospital of Delhi NCR. And going forward, we recently acquired the adjacent land parcels to these hospitals, where we are extending and increasing our bed capacity. And we are also planning to grow inorganically, whereas we are planning to acquire new hospitals in the regions of Delhi NCR, North India, Uttar Pradesh, Haryana, Uttarakhand. So there's a lot of capacity that is coming up in terms of beds in next 2 to 3 years.
All right. So next I want to discuss about competition. So Mr. Yatharth, competition in the healthcare industry is so fierce right now. So what sets Yatharth apart?
So, we are present in cities which are increasing in population year on year. If you talk about Greater Noida, when we started this hospital in 2010, we were sort of the early mover here. So that time Greater Noida was developing as a city. Then 2013 also, that time Noida was still on the continuing development path. So we have over the years we have built a strong presence in these geographies because we had an early mover advantage, and people connect a lot to a brand here. And we are the highest bed capacity in these regions. So we are one of the biggest players in the geographies we operate. So I think that's a very good competitive advantage we have over the other hospitals. And going forward, even if big hospitals start in our geographies, we, as I already told you, are already expanding our hospitals and increasing the bed capacity. So even 3-4 years down the line, as I said, we'll still be among the top 3 to 4 largest private hospitals of Delhi NCR.
Lastly, I would like to know what is the company planning when it comes to the IPO? What are the plans?
So, overall, if you look at the issue size, was around 807 crores, out of which 120 crores we've already raised as part of pre-IPO. This was done around 2 weeks back. So the remaining amount, around 610, was earlier the primary. So if I tell you the breakup of the overall, including the pre-IPO, the 610 crores that will go into the company, we are using 245 crores to repay the existing bank debt that the company has. So post-listing, the company will be completely debt-free and repay all its bank loans. Second is, around 133 crores will be utilized to buy new medical equipments in the existing 4 hospitals. So, we are buying latest machines for oncology when it comes to cancer treatment, like PET scan, LINAC, gamma ray for nuclear medicine, as well as we are buying robots in Indian healthcare. Robot is the new thing where robots like Da Vinci Xi are being used from, you can count on your fingers how many hospitals in North India are using these advanced technologies. So that's the plan. From 133 crores, we'll be buying all these medical equipments. Then remaining 65 crores is reserved for unidentified acquisition. As I mentioned, that we will be looking to expand in the nearby area of North India. So 65 crores will be used for that, and the remaining is GC, that is a general corporate expense, which I feel a lot of it will actually be used for acquisition funding only. So that's the overall breakup of 610 crores.
All right. Well, with that, we have reached the end of our segment today. Thank you so much, Mr. Yatharth, for joining us on ET Markets live stream and talking about the IPO.